back to another episode of Rehab Now with consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor. Hello, Doc.
Hey, Alicia. How are you?
I am wonderful. Everybody, I'm your host, Alicia Taylor. Today we have in studio a nice little special returning guest. One of our
favorites.
One of our favorites. Physiotherapist. It's too much with the
yeah, fantastic.
Physiatrist.
Oh yeah.
That's what I'm saying, man. I'm just so used to. Anyway, physiotherapist Jacine is here with us. Hey, Jacine.
Hey, girl. Hey.
Yeah. Today we're talking about carpal tunnel syndrome. I'm gonna get these names correct. I know it. I believe in me.
But you pronounce it properly.
Thank you. Carpal tunnel syndrome. Mm-hmm. Yeah, man. That's interesting because I have no idea what it is really, but I'm sure I know it, but I don't know that I know it. You know what I'm saying? Mm-hmm. Yeah, great. Okay, remember to check out our social media pages on Instagram. We are Rehab Institute. Caribbean, Dr. Paula Dawson, Alicia Taylor Music on Facebook. It's Rehabilitation Institute of the Caribbean, and the website rehabcaribbean.com. Yes. Okay, so who's gonna get started with carpal tunnel syndrome and just kind of tell me what it is?
Okay.
It's gonna be you, Jacine.
Is it gonna be me?
I try to talk. She said, okay. So
I know, right?
I have to be very responsive, you know.
Oh, it's not you. So it's not you. It's Doc.
It's Doc, and then I'm the backup.
Got it.
No, you're
Strong
not the backup.
backative.
We're co front up. We're not backup.
Co-front up. You know what? I don't even. I'm done.
Okay. All right. We have fun here on Rehab Now. So the carpal tunnel. What is a carpal tunnel? Where is a carpal tunnel? Mm-hmm. Your wrist.
Okay.
So it's at your wrist. So the carpal tunnel is literally a tunnel. It is a space where it has a membrane. It's right at your wrist. So if you say hands up police and your palms are facing, the carpal tunnel is right at your wrist. Mm-hmm. Okay. And it is a space that has 9 tendon and 1 nerve. And on the top of the tunnel is something called a retinaculum, which is like a membrane that goes across. And then at the base are the carpal bones, right? We have 8 carpal bones, you know. I don't want to call all of them right now because you might think it's Spanish.
I'm sure it's Spanish. Though if you look up
it's
origin,
Latin. It's probably Latin.
Mm-hmm. Same thing.
True.
Scaphoid, lunin.
She named them. She named them.
All right. So I'm not gonna go through all of them. But anyways, and so it's a small space. It's a space where these structures go through. And anytime you have a tunnel, you can have decrease in the size of the tunnel, and anything that's going through the tunnel going to get squeezed. Like like when you wear tight shoes, you squeeze your foot. And so the carpal tunnel is that tunnel, but when you have carpal tunnel syndrome is when the structures that are going through the tunnel get compressed for whatever reasons. And so the nerve, the median nerve, which is a nerve that causes the problem, it innervates or sends nerve sensation to the thumb and 3.5 fingers. So it's the median nerve is a 3.5 nerve. So the thumb and the next 3.5 fingers. So the little finger and half of the ring finger is the ulnar nerve, and the other 3.5 is the median nerve. So when the carpal tunnel syndrome comes on and the nerve is being compressed, you get pain in that area. 1. You get weakness in the thumb because this fat muscle here, the fat pad of the thumb, that is called the thenar, T-H-E-N-E, or thenar eminence. You have the hypothenar eminence over here, and the thenar eminence. What am I saying over here? I'm not even. We're on the radio.
It's fine. I'm seeing it.
The thenar eminence is at the thumb, the fat part of the thumb. You know, like when you need dumpling.
Yeah,
you use the thenar eminence to knead dumpling, right?
Yes.
And the hypothenar eminence is that fat area over by the pinky finger. And so when you have carpal tunnel syndrome, you get pain in the 3.5 fingers. You get weakness of your thumb and those fingers as well, but primarily the thumb, and that little fat pad area by the base of the thumb will get smaller. And so you get wrist pain.
Okay. So carpal tunnel syndrome is wrist pain.
It's pain originating at the wrist because of compression of the median nerve. However, I like that question because it can refer up the forearm.
Okay.
It can trick you. It can refer up. It can refer upward. It can usually refers down. And then you have the weakness and pain. And there are particular times when you get it. You know, people will wake up at 3 o'clock in the morning and flick their fingers. It's actually called the flick sign. So they flick the finger. So patients will complain of pain and stiffness and weakness in the area.
Okay, so what exactly causes the tunnel syndrome? Sorry, the carpal
Tunnel syndrome.
I mean, I know you say it's like if you're squeezing, like squeezing of the joint. Is it not joints? Then with them name.
Well, the tunnel
The
gets
tendons.
narrow.
The
basically,
squeezing
right.
of the tendons.
Yes, yes.
And so, but what causes that if somebody like smashes your hand?
You know, that's a good question.
Right. All right. So usually carpal tunnel syndrome is caused by an overuse of the wrist.
Overuse. Okay.
Right. So a lot of persons who have desk jobs and typing a lot, that can cause a lot
makes
of
sense.
overuse. Persons who are playing sports and using the wrist up and down.
What about phone?
Yeah, don't say it on the phone too, because not everybody's like,
That's
are they like this? I don't even know.
no man. This is people with them.
And then they come to true.
Yeah, because
Yes.
I'm texting.
That show my
and then-
age, right?
Yeah.
Talking about phone at the ears.
That's all right. That's all right.
Right, and then also it can happen in pregnancy as well.
Absolutely.
Right,
Pregnancy.
because of the retention of the fluid. So that will cause the tunnel to narrow as well. But a lot of persons you see is because of overuse and injury.
Yeah, man.
Use an injury. All right.
Yeah. So as Jacine said, you know, pregnancy. It's interesting thing about pregnancy. Why in pregnancy? Well, glad you asked. In pregnancy, there's retention of water. And so with retention of water, it kind of deposits, for want of a better description, in the canal, making the canal tight. You know, like when your shoes, your feet get swollen and it can't fit in your shoes? It's kind of like that. So the whole body gets swollen in a sense when you're pregnant. But it's not only pregnant women as well. People with systemic disease like renal failure, cardiac failure, those people who retain water all over. But as Jacine said, repetitive use. You know, painters, hairdressers, anybody who's always using the hand
You know, when I heard
occupation.
when I heard tunnel, this is gonna sound really foolish, but when I heard tunnel, I just thought that it meant, you know, like when you said the water, I thought that it was something that's filling up the tunnel in this area that's causing the problems. Like water probably filled the tunnel area, or you know, something why you have carpal tunnel syndrome.
Not too far off.
Not too far off.
No, with retention, remember? So
Yeah.
fluid. So that's one reason.
Yeah.
Not too bad.
The tunnel gets tighter. So you have other tunnels, you know.
Okay.
You have cubital tunnel by the elbow, your funny bone. And you have, well, it's a Gian's canal, the one on the little finger side. On the fifth finger wrist side.
Just call them which one of them there, and but call the name.
Yeah.
Probably not really. Didn't,
yeah, like the
Little
name.
finger tunnel.
Little finger tunnel.
Easier, you know.
So
where it is.
so I have, let's say I have carpal tunnel syndrome. What you know, what's gonna happen to my my arm, my wrist? You know, this all sound weird. But can you have carpal tunnel syndrome so severe that you just completely lose the function of your wrist, or that's like too extreme?
I wouldn't want to say it's too extreme, but I mean, usually it's leading up. So most people catch it before it ever get there. I don't think I've ever seen a patient lose complete function. Have you?
No, not
Nobody's
at all.
gonna sit down
But
with
what
that.
what you have though, patients who neglect, you get wasting of the muscle. The muscle
So
by
what
the
do
stone.
that mean? No, wasting of the muscle. Why? What happens when
Weak.
you?
So realize we said it's a fat pad. So
Yeah, man,
imagine
so it
just
just
get
gets-
skinny and just suck up.
You lose the muscle bulk.
Muscle bulk is just right.
So I would be able to. Would I be able to lift things?
No, because it's going to be very weak.
Yes.
Right. So imagine not being able to use your thumb.
The devil is a liar. I won't be able to use my thumb if it's just like. So tell me about the pain, because I know this lady that said she had carpal tunnel syndrome, but she was saying it was excruciatingly
Oh, yes.
painful.
It is.
But why is it so? Because you hear me and talk, let me know doctor things and terms, you know, because I know like when you get to nerves, that kind of pain is
Love it.
excruciating,
Girl.
So what's happening with the carpal tunnel? Because you have nerves going on here.
Right. Because remember, Doc had said he had the one nerve, the median nerve. So you're going to have that compression on the nerve.
So the nerve will get compressed.
The nerve is
getting
getting compressed.
Absolutely. So
that's why it's excruciating.
Yeah, and that's why you can have the weakness as well, and then sometimes you can have changing sensation.
Absolutely.
So, yeah.
What's about sensation?
Changing sensation. So sometimes they can't tell hot or cold, or
Stop
they
it.
can't tell if somebody's touching you.
Stop.
No pressure, be touching you like this, and they don't know that somebody's. If your eyes aren't telling you that somebody's touching you, you're not feeling stuff.
Yeah.
Right.
Sorry, Doc, you were gonna say.
So carpal tunnel syndrome is an peripheral entrapment. We're going to talk about nerve entrapment. So the different parts of the body, different structures that can compress the nerve. And as Jacine said, the median nerve is going through the tunnel. Because the median nerve is closest to the surface, it's going to get compressed. And so the nerve will carry one sensation signal to the brain, but motor signals to the muscles. And so if you don't have the motor signals, the muscles eventually get weaker and weaker and atrophy. And then you can't do some of the opposition, which you carry the thumb across to the little finger, and you can't
You make number 4. You can't make the 4.
Right. Oh, I like that. I like that, Jessie. You can't make number 4, right? Because that muscle, the pollicis, opponents.
That doesn't sound bad. Not bad. Thanks.
Not police,
God. The policist.
The opponents. The one that goes across to make the number 4 sign that one gets. We can have some other ones. The loaf muscle, they're called loaf. It also innervates the muscles that do this, the lumbricals, right? And then the ones that do this, the interossei. So you lose the function.
Like the Star Trek.
That's what I'm saying. That's what I'm saying. I'm thinking that you're losing function in like a...
Absolutely.
Man, that's crazy.
Right.
Sorry.
Go ahead, my dear.
Do you get like twitching though? No, that don't.
You can get tingling. Because any
Tingling,
form of...
but I mean, like if you're on, the little twitch thing. No.
No, that's a good point. I've never seen
I've
that.
never really seen it.
I've never seen that. However, when you do have
says so.
nerve issues, you can get...
Twitching
Yes,
thing.
I mean, volunteer
Interesting.
movement, some
I'm
twitching.
going to look for that and ask in the history.
Yeah, man, and tell me.
Yes.
This is good stuff.
Yes.
Good question.
Thank you. Thank you. I'm really learning, You guys see the results? I'm really going on with
you, Alicia, you need to consider it.
I'm not going to consider 7 years. I'm not doing that. You know what I'm going to consider? I'm going to consider a break. That's what we're considering right now. We're going right to our break. We're at Carpal Tunnel Syndrome. So when we come back, we talk about treatment. Mm-hmm. Yes.
That's a fun part for me.
No, for me too. I got a physiotherapist.
Yeah.
So you're going to tell me. We'll be right back. Stay with us. Welcome back to Rehab Now. If you're just joining us, we are talking about carpal tunnel syndrome. We have Jacine, the physiotherapist. There, I said it and I got it correct.
From the
Rehabilitation Institute of the Caribbean. Thank you so much. We have Dr. Dawson from the Rehabilitation Institute of the Caribbean. Sorry, I'm not looking at your face. Don't worry.
And we're on Power 106.
And we are on Power 106. My God, I've always wanted to do that. Anyway, so we're talking about carpal tunnel syndrome. And before the break, we were talking about the symptoms. And you guys were explaining what carpal tunnel syndrome is, opening my mind. So we're gonna continue. I'm gonna ask Jacine to, right before we get into treatment and stuff, talk about some more of the symptoms, because you want to know. Understand?
They can self-diagnose, right?
Yes,
Say Google doctor,
self-diagnose.
right?
Women don't self-diagnose, right beside me.
Exactly.
Okay. Go right ahead. Tell us the symptoms.
So as
more
we're
symptoms.
talking about, having weakness, so with weakness, how it may present to you is that you're having issues like trying to open doors, even trying to open a water bottle. So just anything that's going to have you grasping objects.
Water bottle.
And turning.
Yeah, turning stuff. Just anything that's going to have you trying to really hold things. Remember, weakness, and then sometimes you probably not even feel it. So you just drop right to
Just you're assessing my life. Keep talking, Jacine. I'm assessing my life. Go ahead. More symptoms. Tell
I'm
me.
feeling so sorry for you right now.
And when you sleep, too.
What about
Right.
Of course, writing as well. That would be affected if you have...
Yeah.
Yes.
Definitely.
Using the
writing,
computer, the keyboard.
Texting your friends, all those things will be affected.
Sleeping on your hand.
And then sleeping on your hand, and then imagine you wake up and you just feel the hand just no more tingling or cramping.
No, but... Okay.
You're not
So,
feeling right.
but people sleep on them hand a lot.
And we get a lot of them at Rehab Institute of the Caribbean.
But they get up and their hand is numb. Does that mean that them have carpal tunnel syndrome, or them just sleep on them and long and them heavy? So, them and I go cramp up. Me want know, because we know, Jamaican have this thing where my hand cramp up.
Right.
What is the cramping different? How is that different from the carpal tunnel syndrome?
All
Because
right.
me sleep on my hand all the while, and when me wake up it numb. So Jacine, please, may I ask
So
you to
key
just
question
tell me
to
what's
that.
going
I want to
on.
know how skilled you are at sleeping. So when you sleep in your hand, you wake up and your hand is numb. Is the whole hand numb or just the 3 fingers are numb?
Or the little finger.
And the little finger, Is it?
Good point.
Exactly. So you will know then.
Okay.
So,
Thanks.
so the
that
thing
helps.
is when you sleep on your hand, it depends on which nerve. Once you feel cramp, it's either you cut off the circulation, which is not
Yes.
likely because your body will wake you up, or the nerve, right? And so if you compress the nerve, it's a median nerve, it's 3.5, counting from the thumb. If it's the ulnar nerve, it's the 1.5. You can actually bend your elbow and sleep and compress the ulnar nerve by the elbow. Or if you sleep bad, you could be compressing the nerve from your neck.
I will even nerve me compress when me asleep in the dark. What the one them in your foot name? Can me compress them one there too?
You remember honeymoon palsy? We're
Yes.
talk about honeymoon palsy where the person sleep on your arm and
Yes.
compress the radial nerve
Nice.
and you get wrist drop.
That's me.
Alicia.
Sorry, I won't.
We are going to talk about nerve entrapment. I think nerve entrapment is a good topic.
Nerve entrapment.
Yes. So we're talking about median nerve entrapment at the wrist, which is called
If you know that.
carpal tunnel syndrome.
I was gonna say it. Look, I just get. It's just I'm having a little memory fog. Is that what it's called?
Yeah.
Just having a little memory fog. But I'm gonna be back at it again. I'm gonna be sharp at it
I
again.
believe in you.
Thank you.
Yes,
So that's it for the symptoms that you have when you're dealing with carpal tunnel syndrome.
Yes.
Okay,
You
great.
can get some decreased range of motion and stiffness around the wrist as well. Not arthritis though.
Yeah.
Thank God.
We don't stress anymore.
Although
Oh no.
Although, if you have arthritis in the wrist bone and the osteophytes are going towards the tunnel, it can compress. Sorry.
Arthritis enough, it always finds a way.
to get in
Salt.
there.
In
It always
everything.
finds. I'm telling you, it's like Satan. Anyway, so let's talk about so that's okay. Wait, how do I know if I have carpal tunnel syndrome? Me not talk about I'm sleeping on my hand. Because that's just one way, right?
Right.
Isn't there some other way that I can know besides being diagnosed by professionals? Oh, I go away.
Yes.
Exactly. Like what kind of
You
trick
left
question
me a
is
while
that?
ago. Just seeing a good thing. You were looking at her like that because I'm like, is there something else?
I'm sorry. Go ahead.
You have to be diagnosed. You have to go through the clinical examination, and there are different tests that we can do.
That's what I want to know.
Right,
What are okay? Oh,
Okay.
carry me through the test. Them I test them one. That's how we want to reach the tests.
Do
So
the
what
thing.
you guys are doing this
Yes.
thing with your hands? What's this though?
Okay, so you have like the phalanx and reverse phalanx. So you have like a prayer pose, like this, phalanx, right?
hurt me, you know?
Right.
Oh,
Stop
really?
it, stop it, Alicia,
Nah,
please.
do-
So
So,
next
Let me tell you which
gentlemen.
parts that hurt me. Right, so.
That,
you just tighten
They
your one.
just-
All right, great. That's not bad. All right. So we do have carpal tunnel. Yes.
Right, because usually when you do this now, it tends to reproduce the
so, ladies and
symptoms.
gentlemen, who are listening, Jacine is doing the prayer pose.
Prayer.
Right. So if you're having carpal tunnel, you tend to reproduce the symptoms. So then you start to have that tingling or numbness or anything going down into the 3 fingers.
Interesting.
Right. So that's how we tend to know. Or you can do the reverse, which is basically putting the back of the hands together
And lifting the elbows
and
up.
lifting the elbows out.
And you stay there for a little bit, and
Right.
if your symptoms are reproduced,
I don't feel a thing.
you have to do that for a minute.
1 whole minute?
Yeah.
That long, Jeez. All right, Tito, no. Am I doing this correct?
Yes.
All right.
So, ladies and gentlemen,
And
she's
it's 1
doing
Mississippi, 2 Mississippi.
I'll terrible miss that,
Right.
Okay. My back tired.
So that,
So that means I have back problems.
yes,
yeah,
yes.
but we don't want to.
Cool.
But you
got
can
it.
also do carpal compression,
Right.
right?
Interesting. Oh, compress the actual.
Tunnel, the retinaculum, and you reproduce the pain.
Okay. You press my
And
carpal.
you can do it for yourself. Too.
Okay.
So Jacine is now pressing.
True, you're a
Alicia's.
physiotherapist?
Yeah.
You can do it right.
Right. And same, I have to hold it for a
And you
little
call
bit.
one
while.
Mississippi. You feel any numbness? So, ladies and
not
gentlemen, if
feeling
you're
it.
driving, well, no, if you're driving, don't do this. If you're
You
driving,
don't feel like it has squeezed it hard enough.
No, I'm not.
So ladies, and gentlemen, if you're at home and you want to know if you have carpal tunnel, you need to go to your doctor or come to Rehab Now the Caribbean.
Do not
myself
self-diagnose.
or Jacine or one of the therapists can. But we're talking about carpal compression, where you use one hand and compress just by the wrist, by the palm side, and you hold it there for a minute. If that reproduces the numbness and tingling in your fingers, then you know you could.
You could have it.
Because if you're just strong and press too hard, it can make it hurt too.
That's a good point. I'm strong enough. People can't pull the oil buckle in at home, you know, when
you close it?
Yeah, man, you can't open it. So that's how I know my carpal tunnel is strong.
All right.
All right, great. So let's say we have carpal tunnel syndrome. What does the treatment look like?
Yes, Miss Jacine.
All right.
Your time.
Okay. So usually, after seeing Dr. Dawson, then she might prescribe some medication for you as well. And then she's going to refer you for physical therapy.
She did that for me.
Right. So then we do our special test, just as we spoke about all the failings and reverse failings, just to really ensure, because sometimes after you see the doctor, things might change a little bit. So we still need to do a little bit of test. So let's say you do have a carpal tunnel. So a good place to start as well is to just find out about your lifestyle. What do you normally like to do? What are your hobbies, your job? Because then we'd have to, modify some things for you as well. So we like to
rehab is a whole
ask some
lifestyle
questions.
change.
Exactly.
A lifestyle approach. So I love you guys,
So other than delving into your life and your, work, then also we like to use modalities. So we might use some electrical stimulation on you just to help with the pain.
It's always electrical things. I wait for them for each right here. So let me just say it straight up. I was waiting on the electricity.
Right. But we're not shocking you people.
Good.
That great. Good. So electrical stimulation, we might also use thermal modalities. So either heat or cold. So icing the hand might help, especially for nerve pain. You find that ice works very well for persons with nerve pain. And then if it's because of swelling as well in the area, then ice is definitely going to help with the swelling. So it's a 2-for-1. And as I said, the heat sometimes, because some persons might have tightness in it. It's like when you did your hands on, you say you feel
the tightness by the wrist.
So want to relax a little bit.
So you need heat. Heat works well for the tightness.
And then we can massage it. People love to hear about massage, and that's just very relaxing.
So massage is good for carpal tunnel syndrome.
The massage is good for everything.
Yes, massage is good for everything.
A true sis. Yeah,
so always treat yourself and come to rehab and get a massage as well.
Right.
You can just come and get a massage at the rehabilitation institute.
We have a massage therapist on our team. And she's very good. She's very, very
do that
good.
as well. And then also, as we said, sometimes you might have weakness as well. So definitely we're going to do some strengthening exercises.
Okay.
Good. And some range of motion for persons who have decreased range of motion. Okay. Good for you. And then also with the sleeping, because some persons like to sleep on their hands. So we
don't sleep on your hands. Sleeping on your hand is a bad thing.
We'll give you splints to wear. So we can prescribe splints for you to wear, like a cock-up splint.
I don't know what a splint is, but
so
it's a wrist brace.
A wrist brace.
So much. You don't like to use terms. You don't feel like that people know.
Right. So you get a wrist brace that will help to keep the hand in a neutral position, or sometimes a little bit of extension, which just helps to relieve the tension in the carpal tunnel area.
Right.
So
fascinating.
Yeah, that's usually most of what we do for you.
So and I love that, because practically all the patients that come to Rehab Institute of the Caribbean for carpal tunnel do well. So the key is to try to prevent them from having to go to the next step. So I love the algorithm. So just as Jacine said, you start with the medication. Now, if there's an underlying problem like pregnancy or heart failure, you have to kind of wait.
Underlying problem.
You kind of have to treat that. So you wait until that goes away. So if, just like Jacine says, you figure out what it is. If it's repetitive, you kind of remove that. If it's because of how your desk set up, one of the things we like to say is ergonomic review. And our therapists at Rehab Institute of the Caribbean are very good at ergonomic review. And I'll let Jacine tell you about the wrist for the mouse rest and the keyboard rest. But what I want to do is after if the therapy doesn't work, you can get injection. You can do corticosteroid or steroid shot under the tunnel, or you can have a surgical release. So we send you to an orthopedic hand surgeon, and they cut the retinaculum, which is the fibrous membrane that's keeping the roof.
Would that be considered surgery?
That is surgery. So you surgically release the carpal tunnel. But the ergonomic and just looking at your lifestyle, changing your lifestyle, is one of those things that's very important.
Can you cure carpal tunnel syndrome just naturally?
What you call natural? You mean like with minty?
Oh, yeah.
You mean non-surgical?
Stop it with some alcohol and hope it goes.
You don't know, Jamaican people say we love rub up on them
Or
something
put
there.
busy on it?
Exactly.
No.
Rub things on it and, maybe it was seeping or the skin. Jamaicans are.
You have a point there, because you have some topical anti-inflammatory, just like anti-inflammatory diclofenac from one of our sponsors. And so, yes, you can treat carpal tunnel non-surgically as well as without the need for injection. But one of the main things we always want to talk about, have you ever seen when people using the keyboard? And I have to mention this. When you have a keyboard, you have to cock up your wrist to type. But what we suggest is that you get a wrist, the little foam pads right across in front of the keyboard so you can rest your hand on it so you're not cocking up the wrist. So you just have the wrist more in a neutral position and typing. Similarly, with the mouse pad, you can have a mouse pad with a foam cushion part as well. So with the mouse, you're always cocking up your fingers and that stresses the canal. But if you have the pad that's keeping the wrist higher, then you can use the mouse without having to cock up it. So there's a lot of ergonomic evaluation, and our therapists, like Jacine, will be able to evaluate you. We do ergonomic review. Jacine will tell the patients take a picture of your workplace.
And let me see, and then we just modify. It's a whole thing.
It really is a whole thing. And we don't actually have the whole day for this
Unfortunately.
whole thing. I mean, because
we have more to say on it, though.
I know, because I will leave. Carpal, something that kind of big, even though it's not. Thanks. I know. I'm getting good at this.
Yes, you are.
Our time is actually up. I'm sorry. That's it. Thank you to everyone, to the listeners, the show producers. Thank you. Power 106. Yes. Remember to check out the Rehabilitation Institute of the Caribbean, located at Suite 2A to C, Ligoni Post Mall. Yes. Thank you, sponsors, the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. We will see you all next week, same time, same place. Blessings.
Blessings. Bye.